Well, it is noon, and let's get going. I want to honor everybody's time on a beautiful Friday, and I'm sure people are anxious to get to hear from our speakers today, and then get on with their afternoon. So welcome everybody, and thank you for joining today's Circle of Excellence presentation. You know, we've been offering Circle of Excellence events and informational events to our donors, people who have supported Overlake over the years. We've been doing this since 2017, and actually, and Mike Marsh, who you'll hear from in a minute, was our first Circle of Excellence speaker back in 2017. So that's fun to have you back again, Mike. And I know that you've been very helpful to us over the years as we provide an opportunity for the people who support us to be able to thank them and offer them some insights into what's going on in the organization that they are supporting. And thanks to all of you. For those of you who I don't know, I think I know most of you. I'm Molly Stearns, the Chief Development Officer here at Overlake. Joining me are many of your fellow friends of Overlake in the audience. And we're really excited today to be able to hear from Scott Waters, our Chief Technology Officer, who's going to, I think, fill us in on a topic that we're all curious about in terms of how we use technology to improve patient care. Before we turn it over to Scott, I'm going to turn it over to Mike, Overlake, our CEO, and many of you do know Mike as well. Mike's going to offer a few comments before he will then introduce Scott. But before we do that, I just want to make sure, and I think most of you are experts by now on how to use how to participate in a virtual Teams meeting. But please, feel free to raise your hand and ask a question, or ask the question in chat. Either way works for us, and we'll be monitoring the chat function. Scott's used to handling any question that comes at him, and either directly or on the screen. And Scott, I'll help make sure that you see those questions as we proceed. Okay.
Yeah, thank you. Thank you.
Okay, for that. Great. And and at the end, after Scott's presentation, if there are questions for Mike, he also is ready and able to respond in person as well. So without any further ado, Mike, I'm going to turn it over to you to get us rolling. And you are on mute, I think.
Molly, I think Mike looks like he might be having a couple of technical difficulties.
Okay.
So.
Okay. All right. I think you're right. I think you're right. So I'll tell you what. Why, Scott? While we work on, Mike and I can work on that. He's going to just come back on. Why don't I? Frankly, let me introduce you. Unless we have Mike back. Are you back, Mike?
I'm back.
Oh, there you are. There you are. We have the gremlins.
In the words of Arnold Schwarzenegger, I am back. Yes.
Take it away. You're
on. Thanks. That's just a little demonstration of one of our values of agility. And so that was a bonus for today's Circle of Excellence. Thanks, Molly, I did hear all of your comments. And Scott, thanks for letting me know that my camera and mic didn't seem to be working. Before I begin, let me just start with Go Mariners. That may be the last time in the next decade I get to say that, but let's all be rooting for our home team over the weekend, and hopefully we'll get a fair distance into the playoffs. And let me add my thanks to Molly's welcome to the Circle of Excellence. As you've heard me say in multiple forums, healthcare is changing at historic rates, and this category today is another example of that. A lot of the change has been driven in innovations in technology that's been related to diagnostic and therapeutic breakthroughs, which is exciting. And a lot of it also is now emerging around transforming the administrative and consumer aspects of healthcare operations in ways that will improve patient and provider experience. And I think that's really most of what you'll hear about today is that part of digital acceleration. Healthcare has been I will say, slow adopter at some of the what other industries would consider fairly basic table stakes. And part of the reason why we have inserted the word accelerated is to try to catch up on what other industries have achieved. But healthcare in general, I would say, has been a slow adopter in this space. And so that's part of the reason acceleration is important, so that we can take advantage of that and continue to be relevant in this very changing environment. However, it's also important to remind you all that, as you've heard in the press recently and from myself and others, that we are facing historic resource constraints. So there's going to be a delicate balance that we're navigating here at Overlake, but one we're super excited about tackling. And investing in this digital technology is just one more way that we're going to be meeting to address the changing consumer and business needs that are in front of us. So, and most excitingly, it'll make it a better patient experience. So again, as Molly said, thank you for being here and thank you for your support of Overlake. So without any further ado, I want to introduce our speaker. Our speaker today is Scott Waters. Scott is our Chief Information and Technology Officer. He is a member of my executive team. He joined Overlake in 2015, and over his time here, when he joined Overlake, he was the Director of Information Technology. Over time, he's been promoted into his current role, our most senior person in this space. Scott has been in healthcare IT leadership for over 12 years, and during his tenure at Overlake, he's participated and led countless innovation activities and advancements for the organization across all platforms that I've spoken to: clinical, therapeutic, administrative, and patient-facing. So we're really happy to have Scott here with us today, and even more happy that he's part of the Overlake family. And with that, Scott, I'll turn it over to you. And I want to remind people to, again, submit questions in the chat, and that I'm also available for questions, that as long as you promise not to ask me any questions about information or technology, I'll answer any other question that you have. So if you have other questions that are related to the healthcare ecosystem as of today and Overlake into the future, I'm happy to spend any time that we might have later on those questions as well. So with that, Scott, I'll turn it over to you.
All right. Thank you, Mike. Thank you all for having me here today. I really enjoy the opportunity to talk about this exciting work. It's a passion of mine. It furthers our mission to serve patients. It furthers our mission to continue to offer the latest and greatest of technology to our staff and our providers and support our community. And I'll touch on a few of those things today. So let me go ahead and share my screen. But again, I do have some slides to go through today, but again, it's about a conversation. I'm really interested in your feedback, your comments, your questions. So drop those in the chat or raise your hand, interrupt me. I'm fine with all of that. So let me go ahead and share my screen, and then we'll get started here. All right. Okay, so, and I'll use the little pointer here to kind of lead us through some of the slide content. So if you get out there in the wild and you kind of run a Google search on digital transformation or digital transformation in healthcare, you're going to come up with dozens and dozens of definitions. Everybody's got their take, lots of buzzwords. And as we sifted through that at Overlake, we came to a very kind of deliberate focus for our vision for digital transformation at Overlake. Mike touched on this a little bit, but we do have an acceleration component to our digital transformation. That's really to catch up, meet the expectations of our patients, our providers, our staff, and our community, and do that through digital means. So we've created this framework, and it's this left side of my slide here, and really to kind of bucket the opportunities and the capabilities that we'd like to achieve into two main categories. Mike touched on this a little bit. One category is around enhancing the digital experience for our patients. That's anything from navigation to finding us to learning more about us, and creating an experience that matches what we all experience in other areas of our life, whether it be online shopping or banking or anything else in that vein. So one area of focus, digital patient experience enhancement. The other area of focus is this area of internal operations, and that's really about looking at strategies to create efficiencies to meet the needs. Our staff, all of us, we're employees first. We're used to experiencing different types of technologies in our day-to-day life, and that frankly hasn't always been the case in the healthcare environment. We're working to change that. So looking to leverage technologies to be more efficient, to have more user-friendly solutions in our environment for our staff and our providers, and things in that area. When we take these two buckets, we come up with a lot of opportunities, a lot of capabilities that we'd like to pursue. And we try to apply a lens, one of these four lenses to the right here, to all of those opportunities. So looking at all the strategies through the perspective of the lens of our patients. Again, at the top here, always going clockwise. The lens of our patients, the lens of our providers, what it's like to care for patients in our environment. The lens of our staff. So what is it like to work at Overlake with the tools, with the processes, and how can digital technologies enhance that? Or in some cases, where are there barriers that have been presented by previous technologies that we can lighten the load on? And then the last piece is around community, and it's really focused on how can we leverage the wealth of information present out in community resources, and I'll touch on this later on in the presentation, to help bring in information around social determinants of health and other things that contribute to the whole health of a patient and our ability to provide that health. So I'll touch on that as well. But those are the four lenses as we start to go through the presentation today, that we're going to dive deeper into each one. And again, as we get into each one, stop me, ask questions, or drop them in the chat, and I'm happy to answer those. All right. So again, our first lens, so this patient lens, and again, we're going to work clockwise around this diagram here, but creating this frictionless experience for patients to search, learn more about their providers and the services that we offer at Overlake. Make it easy to find Overlake digitally, make it easy to determine what types of services we offer, the providers that provide those services at Overlake, but take it a step further. Allow connection, genuine connection between our patients and our providers. Allow them to look for a provider that speaks the language that they prefer, has similar cultural alignment and interests, providing a digital front door that serves that up to the patient in a way that's digestible and a good experience for the patients to where they want to come back. So really be able to search and learn more about the providers, the services at Overlake, learn more about Overlake. Then once we search as a patient, we search and we want to get the care that fits our life. So what does that mean? It means meeting our patients where they're at, where and when, and how they want to be met. So offering anything from virtual offerings like telehealth or asynchronous visits where you're kind of doing a secure text type of visit back and forth with your provider, all the way up to and including our inpatient experiences. So really meeting patients where they want to be met at the most convenient times for them. And then leveraging in technologies to help that be a more enhanced experience for them. So in the instance of virtual or telehealth, offering up home monitoring, vital monitoring solutions that patients can kind of hook up to for urgent care or primary care visits to do simple things like, exams for ear infections or strep throat, those kinds of things, and get real diagnostics level vitals information sent directly into our EMR in the context of a video visit, so that our providers have everything they need to do a really thorough and complete visit with a patient while the patient can stay in the comfort of their home. So that's kind of meeting them where they are, and then building this relationship. So I think historically we've implemented electronic medical records and other things within the healthcare setting. And while it's given us a wealth of data, it has created a little bit of a barrier between the provider and the patients. And that barrier is very evident when you go in and to your clinic setting and meet with your PCP, and you see them just typing away on a keyboard, right? They're entering data, important data, into the electronic medical record, and a lot of times they're not really making eye contact as much as they would like to, and certainly not as much as our patients have said that they would like. They want more of that face time. So how do we develop technologies and implement technologies for our providers, which I'll get to in just a second, that allows for a more robust and enhanced and personal visit with their provider. So we'll talk a little bit about that. It's about reducing the burden of documentation for our providers. It's about integrating the information and auto-filling things all over the system, but it's also about some of the kind of more, I call them whiz bang pow technologies, the kind of fancy technologies like ambient listening and natural language processing that can help the providers be more efficient and physically actually turn and have the conversation with their patients and make eye contact more often. So building that relationship. And then there's navigation, right? So in the case of a patient coming to the medical center, to our campus, looking at technologies to help them digitally wayfind through the organization, whether it's the floor or unit or within a specific room within the organization, we're working on technologies to allow step-by-step instructions, a lot like Apple Maps or Google Maps, that will allow the patient to walk through our facilities and have this enhanced wayfinding experience. So we're working on things like that. And we find that is really big for patients when they're visiting. It's a very stressful and intimidating time for patients, and allowing them to be able to find their way on their own without having to ask for help gives them a better sense of empowerment in a time when they may not be feeling as empowered as they would like. So, and as we continue around this this patient journey, supporting their care journey, that's really about how can we pull in information from the community, which I'll get to later on in the slide presentation, to enhance the whole care for the patient and provide the information that they need and the interactions that they need as they're journeying through whatever their particular care plan will be. Communications. So how do we keep our family members and the group that surrounds the patients, that supports them, how do we keep them in the loop from a communications perspective? There's a lot of different opportunities to do this, and some of it is very simple, some of it's more advanced, but really the bedrock of that is ensuring that people know what's happening, why it's happening, and when it's happening with themselves, their own patient care, but also having their family members involved in that communication loop as well. And then as we start to kind of round the corner here, we're getting into some of the, more interesting from a technologist perspective. The technologist and kind of the tech geek in me gets really excited about some of this stuff. Really looking at leveraging digital innovation to begin to kind of layer in, artificial intelligence and harnessing the power of machine learning and predictive analytics to identify and work with our patients on things that have not occurred yet, and allow us to be more proactive with their care plans and work with them as a partner. And this is where it gets really exciting, and we're starting to just scratch the surface on some of this, and it's already showing really positive results. But we want to continue to expand that. And that kind of goes into this next step would be not just predicting what may happen or risks of things happening, but taking action and building out plans using artificial intelligence. And there are some examples of this in place right now, but we want to continue to expand that so that our providers can focus on the most complex things and top of license work. So I'm going to pause right there and see if there are any questions around just this patient journey focus, this slide, before I move on to what will be the provider lens. Just looking at the chat here. Okay. Well, if you think of anything, drop it in the chat, or we can ask at the end. Okay. So moving on to our provider lens. So we just went through the patient journey. For providers, it's really all about putting the joy back into practice. Providers, healthcare workers in general, get into healthcare to help patients, to get that personal touch, those experiences interacting with patients. And I think I touched on this on the previous slide, but a lot of the technologies we've implemented over the last 10 to 15, maybe even 20 years have actually gotten them further and further away from that, and gotten them more in the position of a lot of data gathering and documentation. So we're working on technologies to really help them harness, or working on strategies to help them harness technology and have it work for them. So the beginning of that, again, we're always going to go clockwise around these lens diagrams, but how do we create an online persona for our providers that allows them to share the things that they think are important in allowing them to have a connection with their patients or the population they want to serve. So providing this really robust directory so that when you, as a patient, when they search for a provider, we can share information that's all curated by our marketing and the providers themselves to really show and let the patients get a glimpse into what type of provider they're actually considering. So that's one piece. And then a lot of this onboarding and training, I think it's one thing to deploy digital technologies. It's another one to get proficient with them, and being able to be agile and proficient with the technologies adds to efficiency and joy of work, right? So we need to make sure that we're training and supporting the providers as we bring new things on. There's this concept of universal health that I'll touch on when we start talking about the glue between the patients and providers, which is all of our caregivers and our support staff, and I'll get to that in a few minutes. But keeping them busy. So not busy just for busyness sake, but busy working on the most important things, right? And so, allow them to be as efficient and productive without being bogged down in administrative tasks and documentation. So wherever we can in the electronic medical record, or by layering in additional tools to lighten the load, we are focused on those efforts. Part of that is about building structures that provide optimized scheduling types of structures for the providers, and rules to kind of keep the types of visits in the appropriate time slots. And then also layering in the predictive analytics to forecast and determine when we're going to see higher levels of no-shows, when the highest demands are during the day, week, month, seasonality. And then this concept of wait list management, so patients can get on wait lists, and if we do have cancellations, no-shows, things of that nature, they just get dropped right into those open slots, so the providers feel like they're very productive during the day. I talked about this a little bit, but I think this is one of the kind of really cooler pieces when we talk about digital transformation, and it's around leveraging ambient listening and natural language processing to get the providers off the keyboard. And this is really exciting. And there's been a lot of successful pilots in this space done all up and down the West Coast with some of the other hospital systems that we interact with, piloting this concept of a Alexa-like virtual assistant that sits in the room, listens to the conversation with the patient and the provider, starts to prep and create the actual documentation and data gathering within the electronic medical record, and does that all while the provider is interacting face-to-face with the patient and is not touching the keyboard. It's very slick. It's getting to a very mature level right now, and it's prime for us to start to take action on and put some initiatives around. So we have that in our roadmap to pursue in the short term here. it's probably the thing you're going to see the most when you go out there and kind of Google search digital transformation in healthcare will be the implementation of virtual assistants, AI-enabled virtual assistants, ambient listening technologies, and the natural language processing, which we've been using that for quite a long time, but it's getting more and more mature. So, and that kind of gets us through to keep us off the keyboard. The communication piece between providers and their support team is critical. If we keep them busy and we have them working in a very efficient manner, their ability to communicate with their team on changes, just routine processes is critical. And so we're leveraging in more and more of these communication opportunities, the technologies to aid in communication, whether it be mobility. So that gets us into let me care for my patients when it's most convenient for me as a provider. I've noted a couple different solutions here, these Haiku, Canto, and Rover. These are epic mobile applications that we have implemented some of them, and then we are implementing the rest of them. But it allows providers to just be mobile as they're walking from one clinic room to another, or they're rounding in the hospital. They're able to get things done in between, leveraging these tools, signing refills, even when they're out and about in their personal life. If something comes up, rather than having to call in and approve a refill request, they can do it with a tap of a button on their mobile device. So really trying to add that convenience and functionality into their provider workflow wherever possible. The last piece here, which is these last two buckets, they're really important. And this really touches on the importance of digital literacy and our ability to be proficient with our technology tools. We're implementing things constantly, and it's tough for providers, staff, even the technologists themselves to kind of keep up with the change fatigue related to this period of time in healthcare. So we're making a very focused approach to how we continue to support and educate our providers around the tools, and most importantly, crossing that digital literacy piece, which is critical, the technical tool proficiency, which is also critical, but adding in the fact that they need to have input on the tools that we are proposing. So we leverage a lot of different focus groups and committee structures to make sure that our providers' voices are heard and actions are taken on their feedback. And they've been heavily involved in the building of this digital acceleration, this digital transformation acceleration plan at Overlake, as have our patients. We've leveraged our patient family advisory committee and other patient focus groups to develop our plans. Okay, I'm going to pause here on the provider slide and see if there are any questions that you'd like me to address before we move on. Okay.
You're stumping the band so far, Scott.
Yeah, I guess so. That could be a good thing or not so good. We'll see.
I think it's a good thing.
All right. So the third lens we're going to look at today is the lens of our caregivers, our support staff, and that's kind of, I put it purposely in the middle because this is the group this is the glue between the patients and the providers, and our ability for our providers to provide the care to our patients. And when we went out and we did surveys with staff members and did focus group meetings and did a lot of assessment work over the last year to build out our plan, there were 4 things that really bubbled up, 4 themes that our staff really wanted to see improvements in. And the first one was this concept of letting me work at the top of my license, right? So get me out of doing things that are either manual processes, mundane tasks, things that could be automated. Get me out of that and let me work at the full potential and top of my license, whether you're a caregiver, a nurse working at the license of a nurse, an MA working at their top of scope, or a technologist working at the top of their ability. let's automate the tasks that are distracting us from our best and most impactful work that furthers our goal of giving excellent patient care, right? So the technologies that we have in mind here are really around automation. So robotic process automation, you'll hear that thrown around a lot. RPA for short, real buzzwordy, but really what that means is let's use computers to do what they're really good at, which is repeatable tasks. And let's automate that. Let's define those things and let's just get those off of our plate for our employees and get them moving on to the things that make them more excited about the work they do and they add the most value. And this is a big piece of employee engagement too. Nobody likes to come in and do, there's always going to be a piece of your job that you don't like. But if we can emphasize the work that they're really excited about and have them do as much of that as possible, then that's a win-win situation for everybody. So we have quite a few different robotic process automation projects and initiatives that we will be doing to help address this particular piece of feedback and theme that we receive from our staff. The other piece, which you would think would be kind of a slam dunk and no-brainer, but I haven't really found anyone in healthcare that's done this completely or well, is this concept of like helping me find what I need. So again, healthcare is fraught with having many different ways to get to the same information or do the same workflow or get to the same goal. And new employees, even employees that have been here for a long time, struggle finding the information they need quickly and at the point in time that they need it. And other industries have nailed this down really well. So using the concept of like leveraging this AI-enabled chatbot to help staff navigate to information quickly, answer questions, bubble up policies that they're searching for, help them self-serve on IT or facilities, trouble tickets. All this stuff can be done really well through AI chatbot types of infrastructure. And we've dubbed this as our universal help initiative. And it's really about building an infrastructure that supports this to where no matter what type of help you need in the organization, you go to one place, you type in what you need help with, and the technology starts to feed you potential solutions to your problem or the document you're looking for, or the person that's responsible for that type of service line or whatever the question may be. So this concept of universal help has been really, really popular with our rank and file staff, with our providers too, and really trying to take the burden of finding the information you need or getting your questions answered quickly, taking that and putting it in the hands of our staff so they can do it on their own. It also reduces the calls into different support departments, like the human resources department or the facilities department, asking questions and requesting help with things. So there's an efficiency play here for sure for our staff. There's also a productivity play that really helps our support departments serve the needs of the organization. So we're pretty excited about that. This concept of making technology intuitive is actually, when we drilled down into this, it was very simple. We have too many systems, and this is feedback from staff. We have too many different technology systems. They all look a little different. It makes me inefficient when I'm switching from one to another to do my work. It would be a lot easier if everything was in one or two systems. Then we learn how that system works, how to navigate. The look and feel, the user interface all looks very similar, and it's a great experience for everyone. So we have a big initiative within digital transformation that's called application rationalization. That's really about, let's get down to the core enterprise solutions technologies that we all use to do our jobs here, whether it's the ERP system or the electronic medical record or infrastructure like Teams, like what we're using today, Teams. I think all of you have probably had that experience where you're a heavy Zoom user or a Teams user, and you go into one or the other that you're not used to, and you can't find anything. And it becomes very difficult and challenging to kind of get your bearings in that new user experience and interface. And if you think about that experience and how stressful that could be, especially if you're required to share your screen or do something like that within a video meeting, think about that in the context of trying to save someone's life out on the floor. And you need access to critical information, and you can't get to it as quickly as you'd like to because you haven't been in that system for a while, and it looks very different from the system you use every day. So really trying to minimize the number of applications that our folks are using, the look and feel, picking when we're choosing new technologies, really looking at the user experience, the graphic user interface. Does it emulate things that we use in our everyday life, such as, I don't know, Facebook or Teams or Zoom or Twitter or whatever, like the basic kind of intuitive engineering that goes into a lot of those products that we really like in our personal life. Healthcare IT companies are getting the hint, and they're starting to leverage that. So we're looking at that as one of the criteria we use to choose new solutions. So that's make technology intuitive. And this last piece is really an investment. Help me grow and learn. So again, with the providers, we talked about digital literacy. That applies to providers and patients directly. It also applies to our staff, right? So how do we ensure that our staff know that new digital tools are coming, feel proficient and confident using those tools? How can they self-serve and further their own education in the digital sphere to ensure that they are adding value to the organization and they feel empowered, right? So some of the things that we're doing here is we're making more robust e-learning options available to our staff. We have set up lots of different infrastructure around serving up, tip sheets and things like that. But we're also looking at opportunities to get staff involved in digital projects that they may not normally do in their day-to-day work, and give them a little bit of variety in their work. And at the same time, they're learning about the project, and they can become super users for us. We get them involved in focus groups and things like that as well. This really has a great connection back to our people plan. So investing in our people, helping them learn, helping them find things that they're passionate about, and also furthering our mission as a healthcare organization. All right, pause there. We're rounding the corner here, folks. We're gonna end with how do we leverage community healthcare information and social determinants of health. Okay. So when we're looking at our digital transformation and acceleration plan through that final lens, that community lens, what we're really talking about is how can we leverage information that's out in the community in various different systems to create this picture of the overall health picture of a patient. And when we're talking about things that we impact, the healthcare systems are only able to impact directly 20% of what makes up the whole health of a patient. So this is the access to care, so making sure that patients have access to get care, and also the quality of the care we deliver. So we impact that directly as Overlake. We've also, for many years, been kind of incorporating these health behaviors, which account for roughly 30% of a person's overall health. Things like tobacco use, diet and exercise, alcohol use. All of this we've been incorporating and doing the data gathering on this to build it into our EMR. Kind of that helps us bubble up helpful insights for patients, education, helps to do a little bit of the care planning. That's been occurring for quite some time. So roughly 20 plus some portion of that 30% is within our control as healthcare providers. The rest of a person's overall health really is outside of the health system, and even kind of we don't always have insight into that or the visibility into the other components of a person's overall health. These are called social determinants of health. I've listed the CDC list on the left. There's a lot more than this if you go out and search on the internet, but it's really about the socioeconomic and physical environment that people live and work in, right? So the social determinants of health, these are non-medical kind of focused elements, the top portion of this diagram here, and they do impact patients' well-being and health. And the problem within the health system is we're in these electronic medical records, and so we don't always have insight into things that can impact this. Are patients experiencing housing instability or problems with transportation? What is the air and water quality within the neighborhood that they live in their community? Do they have family support and structure? We know that when a patient's discharged, if they have the adequate family social structure in place, they're less likely to get readmitted. We know this. If they're employed, then we know that they're likely to be more successful in being able to afford their prescriptions or their follow-up appointments. Do they live in a safe community? Do they feel comfortable in their community? So all these things do play into an overall the overall health of a patient. So when we look at that, I mean, we've had reminders and things like that set up in the EMR for, like I said, for years. We have questionnaires now. So for these health behaviors, we've had reminders, we've had questionnaires. Anybody that's gone to their doctor in the last, I don't know, 5-10 years will get asked about tobacco use and talk to, if you put on a few more pounds, they'll talk to you about, healthy weight and exercise. They ask you questions about alcohol use, things like that. So that's been in for quite a long time. We're starting to leverage the EMR and questionnaires within the EMR to ask patients about all these socioeconomic factors. And so some of you have probably had your provider ask you some of these questions. Really, that's only a piece of the puzzle. The providers need to know kind of history. And as a patient presenting, whether you're in the ER or with your primary care, that's a stressful situation. The patient may not remember all the different, visits or all the times that they've struggled with, finding transportation to their appointments or how many they've even missed, right? So being able to pull data out of a system to give us history can really help us with ensuring that patients get the care that they need. So this social determinants of health piece is a big component to leveraging using our community lens and gaining insights to add value to the care that we give patients. The cool thing about this is that right now there's a lot of the digital platforms and the large tech companies and the startups, they're all starting to get in line and see the value in this. I've given a couple of examples of large tech companies that are tapping into this social determinants of health space. Google and Apple are doing a lot on the wearable space, and I bet most of you have some type of Apple Watch or some type of wearable right now. There's a lot of hooks to pull that information into the EMR, which has been really helpful and very forward thinking. Uber and Lyft, this is actually kind of I talked about the Alexa piece, which is that machine learning and enabled natural language processing that we want to leverage within the clinic setting to help our providers with documentation. But the Uber and Lyft piece is actually very cool. They've built hooks into a lot of the electronic medical records to be able to determine whether a patient, if you click certain boxes and get certain information, if a patient's experiencing transportation challenges, to just pop up within the context of the EMR. Again, not leaving the EMR space because we want that user experience to be really slick for our staff, but within a window that looks like it's in our Epic EMR, you can actually schedule an Uber pickup for the patient if they don't have a way to get home. You can also proactively schedule an Uber or a Lyft ride for patients that may not have a way to get to their follow-up appointments. So this stuff is really starting. It's no pun intended, but the rubber is hitting the road with some of this stuff, and it's actually being used every day. It's not just pie in the sky conceptual stuff that's been proved through a small pilot or something. This is becoming widely used. There's a bunch of startups doing cool things in this space too. relative to social determinants of health and being able to pull that information from multiple different resources and populate the EMR with it. The piece I would say, when you look at this diagram here, this is kind of everything, all the different places where we can get information around all those factors I showed you on the previous slide. So we're this healthcare provider slice of the pie, our electronic health records, and any information in there, we can see that. We populate that, we can see that, we've got that part nailed down as a healthcare industry. We also get some information from the government systems around benefits eligibility and things like that. That's pretty good. The payer information is also pretty good. So these three pieces are really tightly integrated, and we've made great strides there to get whole health information in these different aspects. The health information exchanges are getting there, and that's pulling information from different electronic medical records across the country and globally so that we can see that in our health record. So that's coming along. The rest of the other half of this diagram is not there yet, but it can be. And this is where we're going to focus a lot of our digital transformation efforts on over the next many years, around pulling information from resource directories. Every community across the United States has a 211 service, and this allows folks to call and get access to resources. They keep track of those calls, and they have a database that we can tap into to see how often a person has called for help with transportation, with housing. There's a laundry list of things that we can pull in to kind of build out that picture of the patient that provides that whole picture and allows us to proactively. Sometimes people are embarrassed to ask for help when they're in the ER or in the clinic. We can proactively offer it to them so they don't have to be embarrassed about any of this, and we can be ahead of that kind of in a proactive approach. We can definitely pull things around housing and transportation all from this 211 directory. So I really look at this, our integration over the coming years with the regional 211 directories as a real key to completing the puzzle of a person's whole health. All right. That was a lot. I'm going to go ahead and stop sharing and see if there are any questions or comments that we would like to talk about.
I have never heard such a quiet group. I think maybe they're just taking it all in, Scott. There's a lot, just a lot there. Oh, there's a question in the chat now. Can you see it? Are you just looking at the chat? Yeah.
Yeah, I can see it. So aside from collecting data, how can we use technology to mitigate the social determinants of health? Well, and I think Mike definitely has an opinion on this. I agree with a lot of the opinions Mike has around our role as a healthcare organization and the social determinants of health space. I think healthcare entities, our role is how can we get all that information aggregated into our electronic medical record, which is how we provide care, to provide the most comprehensive view into a patient's health, and plugging in different things to make things easier to help fill some of those gaps, ride share, things like that. Connecting to community resources and having those published within the EMR will help with our care managers, our social workers, things like that. So that's how I think we can leverage that. We're not going to solve a lot of the challenges within the social determinants of health space as a healthcare provider necessarily, but I like Mike's. I think Mike, I want to paraphrase for you here, but where Mike kind of articulates us as a convener, as an enabler, a seat at the table in those spaces. So,
Scott, are you seeing the next one? Dr.
Yeah.
Yeah.
So can you maybe take yourself off of mute and tell me a little bit more about your question related to risk, exposure, and liabilities? I want to make sure I'm answering it correctly. I think this is Dr. Ismail.
Yes.
Yeah. Do you hear me now?
Yes.
Because it's a medical issues and healthcare, we have the exposure, HIPAA protection. And if you've gone to follow up complete automation, sometimes documentation will go, and sometimes decision will be made not what should be done. And the more you expose and you increase your connection to online, you increase your risk of like cybersecurity, something will happen. And it's a healthcare and you have to protect, find the balance and to protect yourself. And you don't want like something happen, because based on automation, based on all of this is needed to proceed with. There's no question about the need to implement. At the same time, you have to the security issues, the safety in taking care of patient, cybersecurity, and all of this. Because
Gotcha.
essentially we're dealing with the healthcare. It's not like in business. It's not like in car dealership or something like this.
Yeah, you're right. This is literally life or death in some situations that we deal with in healthcare. The way that I would frame this, Dr. Ismail, is we have the concept of, I like to look at it as one-way and two-way doors within healthcare and technology. A one-way door is once we deploy something, we turn the switch, it's really hard to back that out. And the impacts are real to patient care. Those we have to be very, very slow and deliberate about as far as innovation. We have to be very careful with those. The two-way doors, and there are quite a few two-way doors, mostly on like the administrative side, reducing some of the burden related to not direct patient care. Those are two-way doors. So we can do traditional innovation there where we go through the door, and if we find that there's an issue, we can kind of adjust and keep rolling. That's how I would kind of characterize the way that we look at all these digital transformation and more innovation-focused technologies. But the comment on cybersecurity and our role as a steward for our patients' data is always first and foremost. It's kind of like the physicians do no harm, right? We have to make sure that we deploy in a secure way. So we are committed to that. But it is a tough, it's a line we have to walk. Great question. Thank you for that. All right, I see a question from, I think it's Whitney. Yes.
Yes.
Okay, so curious about new options for scheduling rides for patients will impact the doctor's responsibility and desire to work at top of their license. Okay. Skilled concierge patient liaison. Yeah, so we're definitely looking at staffing models, at care models. The way that this new kind of transformative time is going to impact the way that we deliver patient care. We don't even, we can't look into the future that far yet, but we are adjusting to ensure that we meet multiple things: patient experience, efficiency, physician experience, our staff experience, and then the overall stewardship of security, which Dr. Ismail mentioned. So I think that we're definitely looking at different options as far as staffing roles and the evolution of that to support some of these things to ensure that providers are able to work top of license.
Mm-hmm.
I think I answered your question. Tell me if I didn't. Right.
Yeah, it's a very good point, Scott. Whitney's question does, and your answer makes it. I think it's important to people, for all us to understand that things are going to be changing in terms of structuring how we provide all these services.
Absolutely.
Yeah.
And we always have to be looking at digital technology through the DEI lens, right? So does it create barriers to access because of digital literacy? Does it enable access? To who? How? So even during the height of the pandemic, when we started to roll out video visits, for example, and everybody, absolutely needed to have some access to a provider, that created some challenges around broadband internet, high-speed internet, mm-hmm. and access to devices that could actually handle the workload of a video visit and things like that. So we're always having to kind of look through multiple lenses. I presented 4 lenses that we look through digital transformation, but we're looking through many more lenses as well.
That's great. Well, I think if anyone else has any questions that they think of after we're done, I'm sure Scott would be willing to answer them offline, get the answers back. So please just let me know. If you've got a question, we can throw it in the chat and we can grab it off the chat later as well. Either way, we'll get you anything you need. I just want to thank you, Scott, for sharing your thoughts, your lunch hour with us today. And Mike, thank you for your opening comments, and mainly, and thanks to all of you, the donors who help us provide all the care that we are providing, and the innovation that we are trying so hard to stay on top of in ways that make sense for us. So thank you. We'll be following up with an event survey. We'd love your input, feedback, what other topics are important for us to be sharing with you. We want to make sure that we're meeting your needs, so please respond. It's quick and easy. And we look forward to seeing you in December 2nd, our final Circle of Excellence for the year, where Mike will once again provide his State of the Industry kind of year-end wrap-up of Overlake and the issues that we're confronting and addressing in addition to technology needs. So thanks again, everybody, and have a great afternoon and a great weekend.
Thank you so much, Scott.
Thank you all.
Thank you.